Good afternoon. So good to see all of you on this very cold day. So good to see you. Hence my snowy background. I thought that that's a little bit more appropriate than my fall background at this point. So we have been talking for many, many years at this point about moving from a more teacher-centric to a much more learner-centric learning environment, right? So both learners and teachers, this is confusing for both learners and teachers, a lot of it. What does that mean? Does that mean that, as a teacher, I just stand back and they get to do a lot of the learning by themselves and I'm just sort of a reference point? And for the learners, what does that mean for them? So one step in the right direction is really helping our learners to be more comfortable with metacognitive techniques. And so I think that's going to be really the focus of what we're talking about today. We have two outstanding presenters today, Dr. Andrew Binks, who is Associate Professor for the Department of Basic Science Education at our medical school, and Dr. Emily Holt Foerst, who is Assistant Dean for Student Affairs and Director of Academic Counseling and Enrichment Services, and Assistant Professor of the Department of Basic Science Education at Virginia Tech Carilion School of Medicine. So thank you both for joining us, and we look forward to hearing and engaging in your presentation. If anybody has any questions or comments, please feel free to either unmute yourself at the appropriate time or just go ahead and type them into the chat if you feel more comfortable to do so, and we'll try to monitor the chat as best as possible and interject appropriately. Go ahead, Andrew and Emily, take it away.
Thank you, Dr. Wicker. Okay, testing is teaching. Andrew and I both feel strongly about this. And as we navigate into this space, I want to use this quote: give a man a fish, feed him for a day, teach a man a fish, feed him for life. I think metaphorically speaking, when we do this work, when we teach students how to practice metacognitive habits, we teach them how to fish. So there's a variety of factors that contribute to a learner being successful in medical school, and metacognition is one of those features. And it's among a variety of features, but it also tends to undergird some of the other elements. And so in terms of cognitive processing habits and thoughtful schema development and cognitive reappraisal in terms of the learning setting, setting short-term goals and long-term goals, it can play a role in a lot of these other elements that contribute to medical student or resident success. So let's move forward and talk a little bit more about it. Today's learning objectives are going to include the positive impact metacognition can have on learning behaviors, some barriers that do get in the way of students practicing metacognitive habits, how you can determine how barriers of developing self-reflective processes can be overcome, and then incorporating it into the curriculum. And so Andrew will talk about that last piece quite a bit. So who is a self-regulated learner? And so before we get into metacognition specifically, I want to pull back a little Google Earth view of things and look at a self-regulated learner. It's an individual who takes a proactive approach to their learning experience. And it's the type of learner who exhibits the traits that many of those of us who are seeking to support medical education want to see in our learners. They're self-aware, they're self-motivated, they set proximal goals in learning, they have the ability to identify appropriate learning strategies for a given goal, they monitor their learning, they reflect on their performance, they're willing to adjust when they identify a space and time when they need to be adjusting for better performance in the future. They self-evaluate and they adapt as needed. And perhaps most crucial, they manage their time appropriately to make sure that all of this is possible. Metacognition undergirds many of these features of a self-regulated learner. It's step one, metacognition, how one moves from being a cognitively passive learner to a cognitively active learner. So to be metacognitive, to think about one's learning, There are a variety of different characteristics or building blocks that are necessary in this space: task awareness, strategy awareness, and performance awareness. So let's break those up in their individual parts. Task awareness. The ability for a learner to say, okay, what is the goal here? What are my goals in learning? And not just to say to pass my next board exam. It's setting those more proximal goals, those intermediate goals that allow them to get to that longer term goal, and be thoughtful about that and what those goals look like. So today I need to learn about metabolism so that I can build upon that. And so then it gets to, what do I know about this topic already? Am I a novice when it comes to the concept of metabolism? Do I define my learning status as intermediate? Or am I an expert in this and I therefore don't need to spend a whole lot of time on it? Identifying where one falls in the continuum of knowledge relative to a given topic really can help them identify what and how they're going to do in that next step that we'll talk about in a moment. They also need to really understand, is this a topic that I struggle with? Can I pinpoint where within this topic that I struggle? If a learner does find something challenging, doesn't like it, or both, that's going to play a role in how they strategize that task. It really does matter how you feel about content. Your brain is listening to you. So you need to identify strategies, and therefore you want to ask yourself strategy awareness questions. What strategies have worked for my brain when learning new data in this type of data in the past? What resources align best with these strategies? So if I know that it really helps me learn metabolism by watching a video about it and having a textbook open at the same time so that I can compare and contrast, pausing the video and looking at the text at the same time, or maybe annotate the text with something that's happening on the video, then I want to employ that strategy in this moment. If I've watched a video and it has been unsuccessful for me in the past, I want to ask myself, why perhaps is that the case? Was I watching it in double speed and not really learning anything? Did I pause it at logical intervals? And so allow yourself to really align a resource with a strategy, and then ask yourself questions about how that strategy is working. Do I organize my material, or do I just dive in? It's always important to really get a plan of attack with a given topic area. And so it's important for learners to really reflect on whether or not they're identifying a plan of attack for their content, or if they're just opening a text or starting a video. Page 1. Which strategies do I want to apply to different types of information? Not all information is the same. Information is manifests in a variety of ways. Some of it's semantic, some of it applies that semantic detail, some of it requires us to integrate information in a variety of different ways. And so the strategy that we employ for different types of information matters. You'll hear learners in the med school level talk about using Anki on a regular basis. Anki is a flashcard type resource that has a time and a place, but it isn't the end all be all. Questions are far superior to Anki overall, unless of course the student is getting hamstrung by some sort of semantic detail that a repetitive process that a flashcard can offer might help ameliorate. Performance awareness questions. Can I successfully recall or apply material to practice questions? So I've identified my task, I've identified a strategy to attack that task, and now I need to really look and see if my plan is coming together as I intended it to. And the way I can really self-assess that midstream is to do practice questions. Those questions aren't just a checkbox experience, they are a learning opportunity in the formative stages and summative stages of learning. And when I struggle with a topic, do I modify how I learn, or do I flee the scene? Well, I'll get to it. I'll learn it eventually. It'll come along. I just need more time. That's fleeing the scene. A learner needs to pause in that moment. No, I don't understand. Why don't I understand? What has been my strategy toward this task, and what perhaps could I do differently in terms of the approach that I'm taking to learn this content? Do I strive to learn from my knowledge gaps in formative moments? So formative moments happen all along the continuum of learning. So if I'm watching a video and I pause that video and I say, all right, what have they talked about so far? What are the key takeaways from this first 15 minutes of this video? If I were a professor and I were writing a question over the first 15 minutes of this video, what would that question look like? If I can't self-assess in that moment, then I need to rewind the video and watch that 15 minutes over. That's one example. Another example would be I get to the end of the video and I do some practice questions and I can't answer any of them correctly. I have not learned from that moment in time. So I need to assess what was going on in that space and how can I correct, not just push forward and hope that it comes along later. What types of mistakes did I make on the formative exams? Why? And do I need to tinker with my current strategy for a given topic? Now, formative exams is very much meant student language, but you could easily change that and say at the bedside when I'm being asked questions by my attending, or you could add any sort of formative learning opportunity that is presented to a learner along the continuum of learning. And Andrew is going to talk more about this particular piece in a moment. So, potential positive impact that metacognition can have on learning. One study that I want to raise in this moment was done on medical students with an N of 55. It was a 5-year qualitative study that interviewed students who had remediated. And these researchers identified that the students that they interviewed, they found they had a cycle of failure, 4 maladaptive themes that led to this cycle of failure. And those 4 maladaptive themes included problematic goals and strategies, which metacognition very much undergirds, and so really reinforces, in my opinion, the importance of metacognition. A second maladaptive tendency was not seeking or accepting support. And so in this one, if we can get our learners to allow us to help them in the moments that they need help, we can help ameliorate that first one by helping them identify goals and strategies to help be successful. If we don't get them to seek and accept support, then they fall through the cracks. Normalizing failure or attributing it to external causes. Sometimes our struggles are related to external causes. That is very much a factor in some learning settings, but it's important to really get into a particular learner's struggles and identify if in fact that is the cause. It can't be, I would argue that it can't be the cause all the time. And then protecting self-worth. It's not me, it's not my fault, I didn't do it. Again, it's important for us to protect our self-worth sometimes when we're feeling moments of struggle, but it's also important for us to own where we have growth and where we have opportunity to do better. And if we help establish a very safe learning environment, we can help our learners both protect their self-worth and own when they have growth to do. Some additional barriers to implementation would be time. Sometimes learners just don't feel like they have the time to do this type of work, but I would argue otherwise, and I'll get to that in the next slide. Poor understanding of its value. They don't see that metacognition is something that they need. I'm not the type of learner that benefits from that stuff. I've gotten this far. I'm in medical school. I'm a resident. I don't need to do these exercises. And mindset. An individual with fixed mindset often thinks that mistakes, failure are not something to really investigate, get into, because again, that notion of protecting self-worth. It's important for us to really help learners achieve a more growth-oriented mindset in that they lean into those mistakes. They allow themselves to really dive into that space. And how we do that is helping learners understand that time spent on the front end is overall a time-saving measure. If you can organize and strategize, give yourself a clear path to your goals and objectives at the front end, and then activate that plan, self-assessing it along the way, you really, in the end, save yourself a whole lot of time because you're not trying to do it at the back end and remediate and repair on a regular basis. Incorporate metacognitive questions into learning moments that help students experience the benefit and develop the habit. Anytime that we as educators can incorporate metacognitive opportunities for our learners to help just have it be part of the routine and a part of their daily practice, they will then themselves develop these habits. I can't tell you the number of students I've met with one-on-one who have said to me while they're studying for step one, for example, that they are really thankful that I have talked to them about some of these habits so that while they were studying for STEP, were employing them. Conversely, the students who regretted not employing these habits and because they didn't have the skills to apply during their STEP study. So really encouraging students to do it early and often is the way to go. Developing that growth mindset in learners to promote the importance of learning in the interest of avoiding suboptimal learning outcomes. And so really, all right, now I'm going to stop sharing for a moment so that we can shift to Andrew's sharing screen. This would be a great time for anyone who has questions to just jump in and ask, and I can happily answer while Andrew is pulling his slides up.
Okay, so with those barriers in mind and trying to overcome those barriers, we've started a project at the medical school to try and have that regular integration of metacognitive processing built into the curriculum. And the idea is that what we want to do is when a student goes through an assessment, they'll immediately look at what they got wrong, but perhaps not why they got wrong. And one of the barriers that we found was most of our assessment is multiple choice. A multiple choice gives you a binary input. We either get their question correct or we get it incorrect. And that helps a student focus on what they got wrong, but perhaps not why. But within those two binary outputs of the multiple choice question answers, whether it's correct or incorrect, there are there's hidden information. The students, if they get the correct answer, we're hoping it's because they're competent and they actually knew the material. Alternatively, they are consummate test takers, and the less likely but plausible reason for getting something correct is that they actually guess correctly by looking at the question and answering hundreds and hundreds of questions prior to taking the exam. More importantly, in the incorrect category, we may have, it's just a simple cognitive error. They didn't know the material, but there's a number of different reasons for even that. They may not have studied the material, or they may have purposefully not studied the material prior to the exam and triaged it. They may have learned it incorrectly, or they may have thought that they'd learned it, but actually hadn't learned it. And we've labeled that a learning illusion. On the other hand, it could have been a simple test-taking error, and these are well described. They could have misread the question, misunderstood the question, simply run out of time, or that classic of changing the answer to the wrong option after they've actually selected the correct one. So within all that binary output of the multiple choice response, there is a direction for the student to ask just what they got wrong. But we tried to integrate a mechanism to get them to encourage them to ask, why did I get that question wrong? So that they can correct that learning behavior. So here's our rationale. We have regular multiple choice questions in our formative and summative exams, but our formative exams also have a review session where we can go through the material. And these have traditionally been very content orientated, where we just assess what the students got wrong, and they're interested in then correcting their understanding. We wanted to take this as a regular opportunity embedded in the curriculum for them to look at why they got something wrong and go through our error self-assessment. The rationale for this is we want them to regularly self-reflect and make that transition of what did I get wrong to why did I get this wrong. But there are other opportunities from that information as well. If we go through a formative exam, and see why they're getting questions wrong. This will help Dr. Holt in her work in student support services to try and improve their learning behaviors. If they can come in knowing their behavior or knowing why they're getting questions wrong, we can focus our support. Similarly, we can actually use that information to actually develop our content delivery. If a large number of students are misunderstanding a material, we can develop our curriculum to cope with that, and we can improve our assessment strategies as well if errors are showing some consistency over certain questions. So we've adopted what we've referred to the error reflection method, or the ERM, and it's based on previously published data from a couple of sources, including Dr. Nolan here at the school. And at the end of a formative exam, the students go through their review, and we ask them for any question that they got wrong to identify from this list what type of error did they make. And the first 4 errors that we list are those test-taking errors that I misread or misunderstood the question, ran out of time, or skipped the question, or changed my answer to the wrong option. Type errors 5 through 9 are all what we've labeled as cognitive errors, that I never saw this material before, I've learned this incorrectly, the content looked familiar, but I couldn't determine the correct answer. I triaged studying this content, which is similar to our type 5 error, and I was convinced my answer was correct. There's our learning illusion. And just in case there was something else, we give them an option to tick other. And here's what we started to see. So I'll explain this graph a little bit more thoroughly, because we asked the students to assess what type of errors they made during the formative exam review, and then we look at their performance in the summative exam. And what we saw was, as they increase the number of errors that they report, they gain more performance in the summative exam. So this is the number of errors that they're reporting in the formative review, and this is their performance in the following summative exam. So what we see is, with the cognitive errors shown with the filled circles, there was an association between reporting more errors and then doing better in the summative exam. But we did not see that relationship with test-taking errors. That seemed to be independent. So we made the tentative conclusion here that as we increase their self-reflection, they actually improved their performance. What type of errors do medical students actually make? Well, here's our test-taking errors here, and this is the percentage of their occurrence, and here's our cognitive errors as well. Fortunately, most of our responses, types 1 through 9, covered the type of errors that students make, with very few needing to tick that other option. Well, the first thing that we saw was that cognitive errors are much more common than test-taking errors. And that wasn't really a surprise to us. What was a surprise was actually the frequency of test-taking errors by what we've always assumed were consummate test takers. 1 in 4 of our errors were actually test-taking errors. And this is inconsistent with our learners' perception, because when they come into Dr. Holt's office, the most commonly reported reasons, self-reported, for why they get a question wrong was they actually label them as the test-taking errors are being the most commonly reported. Well, we see from our data that they're not the most common error. And if we ask them to formally assess what type of errors they make, it's actually the cognitive errors. But they're coming into Dr. Holt's office saying that it was my fault on the exam, when really there's a more significant problem with cognitive errors. So looking a little bit more closely at those cognitive errors, I'm cutting off there at around about 10% to look at those, an arbitrary cutoff, really, to see what are our most common errors. And then number 5, number 7, number 8, and number 9. Looking at those a little bit more closely, number 5 is I triaged the material, or I I left this, I never saw this material before. And so this is a formative exam. So one of the possibilities is that they've not studied this material for the formative with the plan to then study it for the summative exam that was to follow. So this was a fairly common error. And this is also seen in number 8, which is I triaged this, studying this material. But by far the most common error was number 7. The content looked familiar, but I couldn't determine the correct answer. And we've attributed this somewhat tentatively to shallow learning behavior, that I read the material, I looked at the content, I thought I understood it, but I didn't have a deep enough understanding to answer correctly. So this was the error that I actually made. And then there's number 8 here, was I actually triaged studying the material. So they're fessing up that they didn't study before the exam and they're going to do this for the summative maybe. Number 9 was our learning illusion, and that comes close to our arbitrary cutoff of 10%. And we've attributed that to learning illusion. Again, I thought I knew this. I was convinced my answer was correct, but I actually hadn't studied this sufficiently to get a full understanding to get this question correct. We then, in the theme of sort of trying to improve our curriculum, we looked at the errors and how they were distributed by discipline. So here's the same graph with all of our errors, but this time we've split those errors up into the frequency of occurrence for these 5 different disciplines: embryology, pharmacology, biochemistry, physiology, and histology. And generally, there was no real effect of discipline. They make the same errors and the same for each of the disciplines, apart from number 8 and number 5, where there was an effect of discipline, and there's a significant difference in the distribution of errors. And so we drilled down a little deeper on those. And number 8, of course, this one here being I triage studying this content. So to look at number 8 a little bit more closely, this is what we saw. Most of our biochemistry, histology, and physiology were about the same number of errors per question occurring for each of those disciplines. But we saw this jump up for embryology and pharmacology. And should we be concerned about this, them making this error, this type of error? But no, we didn't have to, because when we looked at the summative exam results and drilled down into discipline, they've performed really well on pharm and embryology. So while this may have been an alert to us, we knew that we didn't have to change anything. It was a behavior of the students that they were just leaving studying embryology and pharmacology until later and closer to the summative exam. And there was no need for us to make any intervention. So with those uses of the ERM, what we've tried to do is to regularly increase the students' self-reflection on what type of errors that they're making, and so they understand why they need to change their learning behaviors, and to make this a normal activity and have it embedded regularly throughout the curriculum. We've also been able to use this to help foster that self-regulation in conjunction with Dr. Holt's office, and support that performance and strategy awareness much more, because now M has that information. As the students walk in, they can say, this is the type of error that I'm making, and so she can focus that support. And we've also been able to focus curricular responses, or not have a response, and just be able to interpret the students' learning behaviors much more readily, as well as help them address those learning behaviors with the student support services. Just to finish up, this is what the error reflection method actually looks like. There are the errors that we've listed. And so for every question that they get wrong, the student then just fills in the question number and labels it with an error type. And that allows us to map back to discipline by using the mapping that we have for our assessment. And we've published this method in I can't remember, In medical education, sorry. If you want to have a look at that paper, the QR code there should directly lead you to the PDF. If there's any questions, we can more than happily answer them there.
We do have a few questions in the chat. Andrew and Emily, if you just want to go through, I think it just starts right with David. Music is right where the questions start. You want to take a peek? Do you see them, or do you want me to?
No, I just opened it up. So David, is it possible to assess our students' fixed versus growth mindsets upon their arrival so that we have a better idea of which students may need additional support, or is this already being done in some fashion? Do you want to address that?
We currently don't assess their mindset, but we certainly could look into how we might do that. There's a couple of mechanisms that come to mind. Something that I can definitely investigate. Good question.
So the next one is from Charlie Schlubner. Don't we actually emphasize the what rather than the why by our emphasis on boards part 1 and 2? Absolutely. That's a very good point, and it's one of those barriers is that the students' learning is very grade focused rather than learning focused, and this is an attempt to make that help them transition from that grade focused learning to learning focused learning by making them just look at the why rather than the what. David, I'm surprised they didn't report more number 5. Never saw this material before. This is a frequent complaint by students. Something shows up on the exam that was not covered in class or other instructional settings. When you formally asked, we did get those surprises. And this is one of the surprises that we did get. And the frequency of complaints by students was similar for test taking errors, as I explained when what Emily hears in her office and what we hear is actually different to when we ask them to be much more self-reflective. And when they are more self-reflective, we get different responses. Arthur, this approach will help develop the skills that are used in practice-based learning milestones called reflective practice and commitment to personal growth. This is really what we're trying to do. I think many medical curricula have elements that are really focused on this is how to be self-reflective, and it may be a workshop and it may occur for 2 hours in 4 years. And what we've tried to do is to really embed this. There is a focus on generating self-reflection, but it's that persistent behavior that we've really tried to establish with using this method, and using the multiple choice assessment has given us that forum, because it was not a well-tapped resource because of its binary output. And drilling down into that binary output, we're hoping that we're increasing that self-reflection. Rebecca Pauly, going back to David's question on mindset, could that be assessed during medical school interview days? I think so. But I think that one of our issues is the students that are not self-reflective tend to avoid self-reflection. Do you want to, so those that really need this,
mindset is also such a tricky topic, because one's mindset isn't it isn't stationary, and it isn't the same among all things. And so I could have a very growth mindset when it comes to snow skiing, and I could fall down 12 times and not have any issues with it, get right back up and keep going. But I could concurrently have an incredibly fixed mindset when it comes to math. And just, I can't do it. It's not for me. I'm out. And so, and both of those things can change over time. Over time, I could decide that, nope, I can't fall anymore. The skiing is not for me. I just don't do it. And concurrently, I could have a math teacher who just inspires me in a way that and allows me to fail in a safe way, and such that I'm like, oh, maybe I can do math. And so I change to a more growth mindset, and I lean into those mistakes. I lean into those falls, so to speak. And so I think that it can be very tricky to try to assess, because I think if in an admissions capacity, we could set up a question that really kind of puts in there, are you a growth or fixed mindset? But it's going to be very specific to that student and the format of the question and that moment in time. So it can be tricky to try to do in that setting. That said, I'll still investigate and see what's out there.
I worry for the same reasons, Emily, about that, especially in the vulnerable place they are when they're applying for med school. But it is so context specific. It looks like John Oppling has a question as well.
Yeah, pardon me, I'm driving, so sorry if there's noise. Andrew and Emily, I love the presentation. Do you have any comments on how this would translate to the clinical setting, where the student might be asked to assess themselves, their performance is assessed on a little bit more subjective criteria, and rarely the hard, yes, you got the question right, no, you didn't get the question right. Any thoughts about how this would translate to a less objective setting, like a clinical rounds or clinical precepting?
I think even if you didn't have the ERM that we are using in the formative setting for the medical school, I think there's still an opportunity to reflect it with a learner in a safe way, post encounter, to say, all right, let's reflect on that moment in time, and where were the strengths and where were the weaknesses in this moment. In terms of knowledge gaps, is it your perception that this is something that can be ameliorated through additional reading, or is there something more going on here that we perhaps would be best addressing in the sim lab, for example, and really breaking the whole experience down into its individual component parts and identifying where within that process things are going astray so that we can address them in their individual component parts. I do think that while it would look slightly different, it can be still applied to the clinical setting as well.
And I would think it would depend somewhat on the metacognitive abilities of the preceptor to understand where the process might be falling down.
Absolutely. I think providing that scaffolding as an educator can go a very long way to helping a learner develop it themselves.
I also wonder if continually reinforced, if as a faculty, a group of faculty, we work together to continually reinforce these metacognitive processes, even though it's context specific, it becomes more natural for a learner to think in that way. So they more naturally adapt regardless of the context to that more reflective process, because they're more comfortable with it. Their self-efficacy increases because they've been successful with it in some contexts. And so they feel they're able to, or better able to, apply it to more challenging areas.
Dean Lehrman mentioned the importance of mentoring in his progress notes today. And I think that fits in with this as well. So if an attending or a resident that's further along in their process really connects with a student to try to help them in this space, this is what I do in these moments in time. This is what I've tried during these moments in time. This is what's helped me. They really lean into that opportunity to also mentor along the way. That can go a very long way for a learner, not just in an individual learning moment, but long-term in terms of fostering their caring, their sense of belonging, and their overall learning process long-term.
Oh, looks like we've got some things coming up in the chat as well. Let's see. I think it's starting back with Arthur. Some schools use situational judgment tests to help discern fundamental skills and or values, but are limited in the way that Emily just described. Great. Charlie mentioned, unfortunately, the prelude to med school, i.e. undergraduate, also emphasizes the what. Exactly. Graduate school is quite different. The why is more of an emphasis. I was thinking the same thing, Charlie, as we're discussing this. It would be so nice if they came to us so much more metacognitively aware. And I wonder if that's a little bit of an equity issue too. There are some schools that really reinforce these processes throughout. Do you tend to see that, Emily, where a lot of learners in their undergraduate education or even in high school have been able to learn some of these concepts and apply them so they're better ready when they hit us?
I think it depends on the setting, truly. In K through 12, and they are definitely leaning into metacognition and different strategies to help learners develop skills over time. But that is happening concurrently with this grade-focused learning. We are grade-focused people, and so they don't always coexist well.
Right. That was a great point about how graduate school is so different. And it's so funny that they use, multiple choice tests to deem qualifications for great graduate school.
Jerry, I feel so fortunate that I went to grad school before med school, to be candid. It-
Absolutely.
Attitude as I approached medicine, it really was great.
I think one of the hopes was with the transition of step 1 to pass fail, this would reduce the grade focus because there wasn't the heavy weight of that number of a graded score anymore. I think we were naive back then. Back when it changed, I don't think we'll see that really helping, but there is still that grade focus. Now it's just a pass, not a number. And I think we've still work to do.
Hopefully.
In different numbers. Okay, and David says, I think that Carol Dweck is one of the primary principal authors of the concept of fixed versus growth mindset. True.
Yes.
She has an assessment tool available online. Absolutely. And then sure, mindset is variable. That in itself is not a sufficient reason to avoid testing it. Agreed. Charlie, this was a great discussion, verbalizes my experiences between grad school and med school, a new insight. Changing attitudes, however, is the next task. Thank you very much. Arthur says medicine tried a similar approach 25 years ago when they looked to find students from non-science majors. Agreed.
Taryn's got a hand up.
Oh, Karen does.
Yes, thank you. This was, I particularly appreciated the breakdown of the data with basic science. This was a tool that Emily introduced to me, I guess at the end of this past academic year. So we started for the multiple choice portion of clinical science, started incorporating that for this academic year. So we'll be interested in similarly breaking down our data for clinical science. We've been doing more of a video reflection, more qualitative with regard to our standardized patient encounters and having faculty facilitated and peer contributing small groups for reflection opportunities, but just trying to think of more and more ways to incorporate pauses, particularly within some of the clinical science activities for self-reflection. So thank you both. It was an excellent presentation.
Thank you.
Arthur also made a comment, grade focus will worsen as there are fewer residency positions than graduates hoping to fill them. Any other comments, questions, areas of concern? Scrolling through here. Just a very helpful discussion. Thank you all so much. And as you, anybody who knows Emily and Andrew knows that they are always available for further discussion, very involved in our faculty development opportunities and ready to help our faculty in any way, shape, or form to improve the learning experience for all of our varied learners. So thank you. If you want to contact them at any point beyond this discussion, please feel free to do so. Thank you. And I hope you all have a wonderful day.
Thank you.
Bye. Thank you.